So hello sir, my name is John Quingy Enriquez from BSN 111H, and today I will perform the assessment of thorax and lungs. So here are the equipments needed. First is the stethoscope, second is the tape measure here, and third is the ball pen. So it should be a marker, but we don't have a marker available here. So gathering all the equipments ensure the organization. So after that, I will introduce myself to the client. So, hello ma'am, my name is G. Enriquez and I will be your student nurse for today. What is your name, ma'am?
I'm Laura Jane Gonzalez, 17 years old.
Birth date, ma'am?
April 24, 2003.
So today, ma'am, we will be assessing your thorax and lungs, and it is okay for you, ma'am?
Yes.
So, after that, we will have hand hygiene to prevent the spread of microorganisms. So before we start, ma'am, we make sure that the windows are closed para to ensure your privacy, ma'am. And tanan nga information nga mag-gather ta diri di na ni magawa sa laan, ma'am. Okay? So, I'm going to ask you some questions, ma'am. Do you have any history of cancer?
No.
Allergies? Asa mo lifestyle, ma'am, na naga-smoke ka, ma'am, ingana?
Wala.
Do you take any medication, ma'am?
Wala.
So, having a history taking enhances the collection of objective data. So, now we will start, ma'am, timbal ka, ma'am, tapos talikod. First, we need to inspect the shape and symmetry of the posterior and lateral view. So, as you can see, the thorax is symmetric. And after that, inspect the spinal alignment for deformities. It is to determine the abnormal curvature of the spine. So, we will have the client stand from a lateral position and observe the normal curvature. So, the normal curvature are the thoracic, cervical, and lumbar. So, now we'll inspect. So, as we can see, the spine is normally aligned. Next, I will go to palpate the posterior thorax. So, as I palpate, it is normal. There is no swelling or any tenderness. And after that, I will go to palpate the respiratory excursion. Ma'am, can you take a deep breath, ma'am? Sapa. So, it is normal because as you can see, while my thumb is moving while the patient is breathing. So, next we'll palpate for vocal curvatures. It is to determine the increase or decrease of lung density. So, we can use one hand here, but I will use my both hands in assessing. So, ma'am, ingon lang 1, 2, 3 or blue moon. Ingon lang ma'am 1, 2, 3. Okay.
1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, so it is normal also. Next is we're going to forecast the thorax and the diaphragmatic excursion. This is to assess the lungs resonance. So, ma'am, can you take a deep breath? Okay. Hold in, okay. Breath, ma'am. Okay. So, it is 5 centimeter and it is the expected measurement of the diaphragmatic excursion. So now we'll auscultate the chest using this stethoscope. So, ma'am, atubangan ta. Ay, talikod pala. Okay. So, it is just normal. After that, we'll proceed to the anterior thorax. So ma'am, mag-atubang na ta, ma'am. We will first inspect the breathing pattern. So, hinga ta, ma'am, hinga. Okay. Okay. The breathing is just quiet and it has an effortless respiration. After that, we will inspect the costal angle, which is the ribs under the spine. It is the evaluation of the expansion of the thoracic cage. So, as we can see, the costal angle is at 90 degrees and it is normal. Next is we are going to palpate the anterior chest. Okay. Ingatan, ma'am. Dapat na ko nasuot ulit. So, it is just normal. After that, we will going to palpate the anterior chest for respiratory excursion. Respiratory excursion. Ingatan, ma'am. So, it is just normal. Next is we're going to palpate the tactile fremitus in the same manner as the posterior chest. It is to determine the increase or decrease of lung density. So, inhale, talikam, inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Okay, it is just normal. Okay, ulit, ma'am. Ulit, inhale. Exhale, inhale, exhale, inhale, exhale. Okay, it is just normal. Next is we'll auscultate the trachea using this stethoscope. It is to assess the airflow through the airway. Okay, it is just normal. Next is we're going to percuss the anterior thorax. This is to assess the lungs resonance. So, ma'am, inhale, exhale, inhale, exhale, inhale, exhale, inhale. Okay, so as I observe, it is just normal. After that, we are done and we will document all the findings and we will summarize all the findings to the client. So, as I observe, ma'am, all the assessment that we do is everything is just normal. Tanan normal siya, wala kay ginabati na sa or wala ano sa imong lungs and wala ko yung abnormalities na nakita, ma'am. So, okay to tanan. And wala na kailangan question, ma'am, kung or any concern. Then after that, thank you, ma'am. Thank you for the assessment, ma'am. Thank you for your full cooperation. And I will use alcohol for proper hygiene before we leave. And after that, we will document all the findings and use the narrative report. So, thank you, sir.